The U.S. is making some progress in its vaccination effort. According to the White House, more than 864,000 shots were administered in a 24-hour period. That is the highest daily rate since July 3rd. The uptick is being driven by fear over the more contagious Delta variant, which now makes up more than 93% of COVID cases in the U.S. Yesterday, Dr. Anthony Fauci warned of the possibility of new, stronger variants emerging if not enough Americans are immunized.
The ultimate end game of all this is vaccination. And that's why we continue to harp on that in a very, very proactive way, that if we continue to vaccinate and we get that 93 million people who are eligible for vaccinations, who have not been vaccinated, if we do that in the immediate, intermediate, and long term, and do the mitigation right now, we will turn the Delta surge around.
All right, joining us now to break it all down is urgent care nurse practitioner Justin Gill. Justin, the Lambda variant, which was first identified in Peru and is now spreading through South America, is also highly contagious and may be resistant to vaccines. Cases have already been found in South Carolina. They've been found in Texas, Louisiana. How concerned are you about this strain, and how can people protect themselves?
Well, thank you so much for having me this morning. I would share some of your concern when you're talking about the Lambda variant. Like other variants that we're starting to see become more prevalent in other areas of the world, the Lambda variant is one where some recent studies have shown that there is at least partial or some significant resistance to some of the immunity that's created by the vaccines. But I want to make sure I'm careful in talking about this, because resistance to the vaccine specifically does not necessarily mean that the vaccine does not necessarily have benefit. The vaccinations, like we've seen with other variants, may not be as effective as the initial studies that were put out, but we still know that they are very effective in reducing severe disease and hospitalization. That doesn't mean that we can't keep our eyes on other variants that are going on, but it highlights the need that the rest of the world exists outside the United States, and there's other variants that are circulating, and there's other countries that are struggling with vaccination. So we have to look at this as a global issue and getting more people vaccinated, so that way we can minimize the spread of future variants.
So we're seeing more and more children testing positive for COVID. I suppose it shouldn't be surprising. Under the age of 12, they're not eligible for the vaccine. Some kids are in camp. Some kids have already started school, so they're going to be in close quarters with other children. In Seattle, doctors are reporting seeing not just more cases, though, in kids, but also more severe illness as well. I'm wondering what you're seeing, and do you think this is connected to the prevalence of the Delta variant?
Yes, I think that's a great question, because kids, specifically under the age of 12, are a group that currently in the United States we cannot vaccinate, although that may change soon this winter and early fall. Yes, we are seeing children that are testing positive in their homes. For the most part, children are not as susceptible to severe disease as adults. But anytime you have an illness where you have a higher viral load, higher number of cases, you can see more numbers of more severe cases that lead to hospitalization. Kids are not necessarily, completely protected from COVID-19. We have seen cases where kids have been admitted to the hospital. With Delta variant, we are seeing some younger people, even vaccinated and unvaccinated, testing positive. But the vast majority of cases that do get hospitalized tend to be vaccinated or unvaccinated individuals. In the hospitals that you had mentioned here in Seattle, many of the people that are admitted to the hospital at Seattle Children's, as mentioned by multiple articles here, is the unvaccinated people over the age of 12 and unvaccinated people under the age of 12. Once we do get some kind of progress on getting the vaccine approved for children under 12, that's going to be a major step in reducing the number of those severe and hospitalized cases.
So let me ask you about what's happening over in New Jersey. The governor there is expected to announce a mask mandate for public school students in grades K through 12. Meanwhile, educators in Florida and Arizona are ignoring statewide bans on masks in schools. I know that the mask debate has become political in nature, but just again, I know that we've been reiterating this for the past 18 months, but explain why masks are important.
Yeah, so masks, we know, and it's been over a year that we've been dealing with this pandemic. They work. They work at reducing the spread of COVID-19. Specifically, the N95 mask can protect you when there is virus circulating in the air. I think that this is a good step in cases where an individual that may even still be vaccinated is exposed to a high repeated number of virus in their workplace. If it's an indoor classroom, for example, if you are fully vaccinated, it is still possible to get a breakthrough infection, and that chance goes up more often you're exposed to high viral loads, which may be present in children. It is a simple step that we can take to be able to slow down the number of cases that are spreading. It's also another step that we can take to prevent transmission amongst students and faculty. I think one of the struggles that we've had in this pandemic is the ability for children to go to school, which provides some benefits. And we have to kind of balance those benefits and the risks that exist with COVID-19. And mask use, specifically within schools, where you have a good number of unvaccinated children potentially, is a common sense step in order to help us get over the pandemic.
So we've talked a lot with you about this pandemic, and so we know where you stand on vaccines. You think vaccines work, and people should get the shot. But it's one thing to sort of think that vaccines work. It's another thing to believe that people should have to be vaccinated. So California is the first state to mandate COVID vaccines for healthcare workers. I know you heard about the healthcare workers at Houston Methodist that sued the hospital because they didn't want to be forced to get the vaccine, which I think shocked a lot of people. It's something that Vlad and I talked about. What's your take on this? You work in healthcare. I don't know if you've had any conversations with people that you know also in healthcare that are not interested in taking the vaccine, but do you think that healthcare workers should be mandated to get the shot?
The quick answer to that question, at least from my personal opinion, is yes. Primarily because healthcare workers are held to a higher standard when it comes to taking care of patients. We're taking care of some of the most vulnerable, sick individuals that have dealt with the brunt of this pandemic, many of them unvaccinated and dealing with severe illness. Healthcare workers need to serve as the example. If we as healthcare workers cannot get to near complete vaccination, what does that say to the public? What does that say to community members that look up to us and ask us for advice? We're not just in a role where our day-to-day job is a job. We're in a role where people trust us. And with that trust comes a responsibility from us as healthcare workers to follow the evidence, to follow the science, to be able to take good care of our patients and not risk spreading COVID-19 to our coworkers. In the hospital setting, it's something where this is where we see people die. We see people lose their lives. We see family members lose their loved ones. And for myself, one of the frustrations of working on the front line is continuing to see people either lose their lives or deal with severe disease when it could have been entirely preventable. So we as healthcare workers need to be able to step up, serve as an example for our communities. We're going to continue to be there for everybody in our communities and hopefully see our way through this pandemic. But we need to lead the way, not necessarily continue to fuel any unsubstantiated claims of vaccine hesitancy or vaccine misinformation.
Yeah, we've seen sort of polls that indicate that if people can just talk to healthcare professionals that they know and trust, they will be more convinced that that the vaccine is effective, more convinced than watching, famous people get stuck with a needle on television. You guys can really make the difference. Justin Gill, thank you so much.
Thank you.